homeless during a pandemic. In the French capital, Paris, healthcare workers deliver masks, sanitizer and food to rough sleepers. In Rome, volunteers conduct temperature checks to test for a fever. Scenes like these are playing out all over the world. Whether living on the streets or in close-knit communal shelters, homeless people are especially vulnerable to COVID-19. As cold weather bites in some parts of the world, they face a double threat. Many homeless people are older and have underlying medical conditions which leave them at increased risk for severe illness. Homelessness organisations say social distancing and hygiene measures are often all but impossible to maintain. This is DW's COVID-19 special. I'm Kate Ferguson. Thanks for joining me. An estimated 150 million people around the world don't have a home. Lack of affordable accommodation, unemployment, family breakdown and addiction are some of the major causes. Now, during the pandemic, homeless people have been pushed into a more precarious situation than ever. In our next report, we'll meet Luky, a homeless man in the German city of Cologne.
Business used to be better here in Cologne city centre. Every day, Luky sits here and hopes for the goodwill of the passers-by. But since the start of the pandemic, the tourist crowds have dissipated and most of the people keep their distance.
There are fewer people around, and fewer people who approach me because they're scared of corona. I guess because I'm homeless and I live on the street.
On good days, Luky used to make up to 30 euros in 3 hours, enough to feed himself and his dogs. But in recent months, he has had to sit here for an entire day. Luky spends his nights under a bridge. He's 35 and came to Germany from Slovakia to find work. He's been homeless on and off for the past 5 years. He lost his last home in August because his landlord didn't allow dogs.
I always have the dogs with me. And when I look for work, employers want to see where I'm registered. But without a home, I have no registered address. Without an address, I can't get a job. And without a job, I can't get a flat and money.
A vicious circle. At least twice a day, Luky makes a stop at the Gulliver, a cafe for homeless people near Cologne Central Station. He comes here to eat, shower and charge his phone. But even here, things have changed. Only 8 people are nowadays allowed to sit in the cafe. Before Corona, the Gulliver hosted 30 to 40 people at once. For many here, this place is a lifeline. And despite the new lockdown measures, it's allowed to stay open.
One of the main problems for homeless people, which will probably get even worse during the winter months, is that there are fewer day shelters and indoor spaces for them to spend time in. And we're not the only institution which has had to restrict its numbers. Others have also been affected.
Sleeping rough through the winter will definitely be challenging for Luky. And he's also worried about corona, especially because he can do so little to protect himself.
I want to stay healthy and I try to be careful, but how can I take all the necessary precautions when I live on the street? I'm always in town with my dogs. I meet other homeless people. I can always get infected, and I'm always at more risk than other people.
A roof over his head. That's Luky's biggest wish during the corona crisis. Then he can look for a job again and no longer has to rely on help from others.
For more on this issue, let's talk to Freek Spineven, Director of the European Federation of National Organisations Working with the Homeless. Mr. Spineven, welcome. What do we know about how the homeless community is experiencing this pandemic?
Well, I think that it's important to note that most homeless people, homeless people in general, are more vulnerable to COVID-19 than the general population. Basically for 2 reasons. One reason is because they have often pre-existing health conditions that make them more vulnerable, and also because their situation, the situation they live in, make them more vulnerable. Like most homeless people live in shelters. I don't have to explain to you that following the guidelines imposed by the the government, such as staying at home, applying social distancing, is extremely difficult when you live in a shelter. So I think that the homeless population is really more vulnerable than other groups of society for the COVID-19 problem.
And with all those factors in mind, what can you tell us about COVID-19 rates among the homeless? Are they getting access to testing and treatment?
Well, on the rates, it's difficult to say because there is very few countries that actually collect data on the infections amongst the homeless people. But what we know is that there is a bit of a difference between the first wave of COVID and the second wave that we're currently experiencing. In the first wave, the echoes we get from the homeless shelters is that they have been able to contain the spread of the disease in the homeless shelter system. Now in the second wave, that seems to be different. We hear from countries like France, for instance, where a study was carried out of the shelter system in Paris, in the Paris region, and they found that in all the shelters that they investigated, that over 50% of the population, homeless population, was actually infected by COVID-19. So we think that it took a little bit of time for the virus to enter into the shelter system, into the shelters, but that is currently the case in quite a few countries. And when the virus is circulating in the shelter system, it spreads very quickly because so many people live together there. Many shelters are overcrowded, etc.
What are governments doing to protect the homeless during this crisis? Are there any best practices that you know of?
Well, many governments are doing things, certainly emergency measures. It has been quite remarkable how quickly many governments have been able to get rough sleepers or people, street homeless people, you could say, off the streets as a public health measure. New shelter beds were created, hotels were used to accommodate homeless people temporarily. Even some countries used empty Airbnb flats to find accommodation for homeless people that is safe. So as an emergency response, many countries did actually quite well. If I can give you one example of a country or a city that did particularly well, it is Dublin, that really has managed to keep the infection rates very, very low. So that's one thing. In terms of the long-term solutions, there's only few countries that actually use the COVID-19 pandemic to change the way they address homelessness, because it's obvious that a shelter bed is not a solution to homelessness. Homeless people need housing, often with support, but housing is important. But there is some countries that use the COVID-19 pandemic as a lever to actually change the way they address homelessness. And the Netherlands would be a good example. The government there has just decided to invest 50 million euro in housing solutions for homeless people and other precarious groups. So they seem to use the pandemic to say, well, okay, we have to go beyond the emergency response and actually think of providing sustainable housing solutions with support if necessary for homeless people.
And do you think there's anything we can learn from this pandemic that might actually help tackle homelessness in the future?
Well, what we learn is obvious, but it is important. It is that housing is the best protection against COVID-19 and against any pandemic, and actually against also a whole range of other health problems. So putting people into shelter as an emergency measure is fine. It's probably progress, but it's not a safe place for homeless people to be. So you actually need housing. Housing is the best protection against the pandemic. And I hope that will sink in with the governments, with the decision makers, that in the future they will put more emphasis on transitioning people, homeless people, as quickly as possible to housing and provide the support necessary. Housing is probably one of the most stark social determinants of health, and I think that has now become quite obvious.
Frick Spinnevent from the European Federation of National Organisations working with the homeless, thank you so much.
Thank you. Bye-bye.
Time now to answer one of your questions. Over to our science correspondent, Derek Williams.
How long does it typically take in Europe to approve a vaccine after phase 3 trial results are published?
It varies, but under ordinary circumstances, so not in the midst of a public health emergency, the scientific evaluation carried out after phase 3 trials by the EMA, the European Medicines Agency, it takes time. Developers first have to submit testing data in what's called a marketing authorization application that governs general approvals for medicinal products throughout the EU. A board at the agency called the Committee for Medicinal Products for Human Use is required to submit a scientific verdict on the application within 210 days. It then passes that opinion on to the European Commission, which makes a decision on whether or not to grant an approval within 67 more days. So all in all, the process can take between 9 and 10 months. But that's under ordinary circumstances. In the midst of this pandemic, the EMA has set up a special task force to help fast-track COVID-19 treatments and therapies. It allows for accelerated action in a number of ways. For vaccines, a key change is that developers don't have to wait until all of their data is final before submitting it for approval, but have been able to submit it instead in batches while the trials are still ongoing, a process called a rolling review. So in the end, the formal assessment will take much less time for COVID-19 vaccines that have proven safe and effective in trials because the EMA has cleared the way for what's called a conditional marketing authorization.